New claims from China are stoking controversy. China now claiming the United States, not that lab in Wuhan, is to blame for the origin of COVID-19.
Okay, well, the communist regime claims substantial evidence suggests the virus may have started in the U.S. even before the first reported outbreak in Wuhan. Beijing is accusing Washington of shifting the blame and evading responsibility, while continuing to insist that a lab leak from the Wuhan Institute of Virology is, quote, extremely unlikely.
Now, this comes as President Donald Trump and U.S. intelligence agencies doubled down on claims that COVID-19 did indeed leak from a Chinese lab. A congressional panel and the FBI have both pointed to the lab leak theory as the most likely explanation as well.
Joining us to discuss, former White House COVID response coordinator Dr. Deborah Birx. Doc, thanks for coming on. Good to see you.
Glad to be with you.
Okay, just generally, what are your thoughts on the origin of COVID-19?
Well, first, we know how this virus traveled around the globe. So let's be clear, it went from China to many Southeast Asia countries, including South Korea, then traveled. There was 2 introductions into the United States, one late, probably January, into the West Coast directly from China, and a second through Europe, probably a little bit later into the mid-February timeframe. We've known that forever. We've known how this virus travels. And critically, I think the most important thing from my perspective, we know China was building hospitals in January. We now know, and we have known, the timeline. And you all know it because you've experienced it. The virus circulates in the community, first among young people. They don't get sick. Many of them don't have any symptoms. It gets to the parents. It gets to the older group, and then it's hospitalizations. And then weeks later, you have deaths. So that whole cycle takes us back to the early December timeframe for the first cases in China.
And also with the China lab leak, again, as you said, it is so easily transmissible between humans. So people potentially in the lab who likely, I guess, first got it may not even have known they had it. And again, so you're saying the timeline really pans out that there really isn't a better explanation. Is that what you're saying?
Yeah, and it could have been, I know that there was virus present at the wet market, but it could have been brought there by humans. I mean, we know that humans were infecting cats and dogs and other wildlife. So this virus was circulating in China late November, early December. It didn't get to the United States until the January, February timeframe. Viruses We've had accidents in labs for decades.
Dr. Birx, expand on that. That can happen, this aspect of lab leaks.
Correct. So even with HIV, there were individuals who got HIV from a lab exposure. And with this case, we know a lot of lab technicians are younger. So you're absolutely right. Just like you just said, very often they wouldn't even have had symptoms unless they exposed themselves and infected their grandparents. And so it's very common for this to happen potentially. And that's what's frustrated me over this last 4 years is we kept talking about wet markets and zoonotic events. That's transmission from animals to humans. But we haven't spent any time really working on additional safety requirements for laboratories as they work with viruses, screening the individuals and testing them to see if they have been exposed, even if they're asymptomatic.
Very, very interesting. So also, though, when what you're saying here is I think a lot of people say, oh, this was an intentional virus put, from China, put upon the United States. But also from what you're saying, that also isn't realistic, considering it would be something that people who work in the lab would have gotten, wouldn't have known they got, and then would have transmitted to other people. And then, of course, the great nature of travel, of course, between Asia and the United States, then it arrives here. Is that, again, the logical step as opposed to something with ill intent?
Absolutely, because if you wanted ill intent, you would have figured out how to expose all Americans at once and cripple our healthcare delivery system, which it would have done. So Yes, this was introduced, most likely a lab accident, asymptomatic spread, several weeks of spread in the community, primarily among young people. Takes 4 to 6 weeks to get to the elderly, and then you could see it in their hospitals in that middle of January. So we know that where this virus came from. I realize that once again, China has signed a treaty, the pandemic treaty with the WHO. But this is exactly what happened with SARS. And the fact that it happened again just less than 20 years later, is we're not preventing this. And we're allowing China to continue to have these kind of issues develop.
Dr. Birx, obviously you've worked with other countries, their health departments just as well. So China, they're accusing the U.S. being the originator of this. Would they ever, the CCP, ever tell the truth to protect themselves? No.
They're
right?
never going to disclose those original samples, which they must have from the November-December timeframe. And they're never going to tell us that they actually know that their virus was circulating in 2019.
Wow. All right. Dr. Birx, always just fascinating speaking with you. Thank you so much for joining us on American Agenda. I hope you to come back soon.